Good evening, ladies and gentlemen. This is Superintendent William Hewitt of the UCC North Person Conference Homeschool 27-2855 USDP coming in on the weekly broadcast where we provide some health information, the latest health information, and also give you some good tips on how to prevent problems. Now, one of the studies that we've been looking at is the Boston Children's Hospital, which I have shown you on my screen. And this is a study of done in December of 2013, published here. And the study said that in nursing homes and hospitals, which were there, that's some big problems unless communication is improved. The results of this study at the Boston Children's Hospital, they're a national leader for research into optimizing patient safety and reducing medical errors. So they minimize adverse events, AE, adverse events, by reducing medical errors. Makes sense to me. Okay, now in looking in Indiana, is there any hospital doing that? I couldn't find it. There may be one. I'm still looking. If there is one, make sure you contact me, 765-293-4057, or you can email me at mygrantcountyhome@isp.com. And make sure your email is recognized, or if you have a message to leave, I'll make sure you give you credit for it. The study in 2013 by Christopher Langerden, MD, MPH, who was the principal investigator, they reduced the medical errors Their types included those with little or no potential for harm, intercepted potential adverse events, non-intercepted potential adverse events, and preventable adverse events. Preventable adverse events decreased from 3.3 per 100 admissions to 1.5 per 100 admissions following intervention, with the goal of improving provider-to-provider communication. Flanagan and Amy Starner, MD, MBA, lead author of the study, designed a multifaceted bundled handoff system consisting of three key components: standardized communication, handoff training, communication again, a verbal mnemonic, and a new team handoff structure. Typically, doctors are trained in medical school to interview a patient and write daily summaries of the care plan. But through vital to patient care, rarely receive communication or handoff training from pharma. We sought to rectify that omission with this study. The researchers examined 1,255 patient admissions that occurred during the implementation of the handoff bundle to measure how it impacted patient care and clinician workflow across two separate inpatient units at Boston Children's Hospital. And they, of the 1,255 patient admission study, medical errors decreased 45.8%. Better communication. They reduced the medical errors and the adverse events by almost half. That's unheard of. Amazing. Great job there. And we're looking in Indiana. We found one possible source, and that's ASC, American Seniors Communities, which has 76 healthcare companies scattered throughout Indiana. They're all different names, but the information I have from the executive director, Stephanie Allen, in Upland, Indiana, right next to the Baylor University, is the program is the same. All employees become patient advocates, and their communication has improved dramatically. And if what she's saying is true, and I have to have her do a presentation or shortly, then that's a great improvement. So we may be looking at a revolution here in healthcare. The next item I want to cover is health problems. Now, there is a serious health risk of a brain-eating amoeba. This was posted May 20th, this week, last week, 2014. There's something vile and dangerous in water. Naegleria fowleri, a brain-eating amoeba. Well, I don't need those fellows. And this is a picture of this, right here. These are the big guys. They're coming to get you, baby. All right. So, they're commonly found in warm freshwater, like lakes, rivers, hot springs, and can cause a rare and devastating infection of the brain called primary amoeba meningoencephalitis. PAM. Yep, that's a nasty looking critter there. Definitely don't want this guy in my brain. And you don't want him in your brain either. So the Department of Health and Hospitals, DHH in Louisiana, and the CDC confirmed the presence of Naegleria fowleri in 2 treated public drinking water systems in September and October of 2013. They're in the drinking water. Oh boy. Now that picture was taken by Marmetin Alhassi the afflicted. The trophocytes of Naegleria fowleri in brain tissue. That is a nasty looking fish. Look at those guys. The amoeba has been responsible for deaths in disinfected public drinking water supplies in Australia, Pakistan, and Arizona. The infections were linked to the practice of piping drinking water over land, sometimes for hundreds of miles, that resulted in the water heating up, which decreased the disinfectant levels. These conditions allowed the water in the pipes to be colonized by the Naegleria fowleri. Those critters right there up above, those guys. And that's because the pipes heat up and the disinfectant levels are not as good anymore. Good planning there. Piping the water over, over the desert, heats up and then it has some nasty things there. It's important to note that you cannot get infected from drinking contaminated water. But there is a risk when washing your face or showering. Infection typically occurs when people go swimming or diving in fresh water and the contaminated water enters the body through the nose. Oh my God, if we got a big nose and I don't want to go swimming. Okay. Yeah. Once the amoeba enters the nose, it travels to the brain, where it causes PAM, which is most often fatal. And this picture of his girlfriend diving into a lake is a credit to Luigi the afflicted. Okay, Luigi, got great legs. It is critical to prevent water going up the nose, so follow these precautions from the CDC. They're the authority. Do not, do not listen. Do not allow water to go up your nose or stiff water into your nose when bathing, showering, washing your face, or swimming in small, hard plastic blow-up pools. Well, that's definitely one. Do not jump into or put your head under bathing water. Bathtubs, small, hard plastic blow-up pools, walk or lower yourself in. I'll do that. Do not allow children to play unsupervised with hoses or sprinklers, as they may accidentally squirt water up their nose. Avoid slip and slides or other activities where it's difficult to prevent water going up the nose. Okay, no slip and slides. Do not run bath and shower taps and hoses, or do bath and shower taps and hoses for 5 minutes before use to flush out the pipes. This is most important. The first time you use the tap after the water utility raises the disinfectant level. Do keep small plastic blow-up pools clean by emptying, scrubbing, and allowing them to dry after each use. Do use only boiled and free distilled or sterile water for making sinus rinse solutions for neti pot. Apparently one guy got this from using a neti pot. Or performing ritual ablution. Do keep your swimming pool adequately disinfected before and during use. Adequate disinfection means pools free chlorine at 1 to 3 parts per million ppm and pH of 7.2 to 7.8. Hot tubs and spas, free chlorine, 2 to 4 parts per million. Oh, that's higher. ppm. Or free bromine, 4 to 6 parts per million. And pH between 7.2 and 7.8. Okay, we do not, we got 2 do keeps and 2 do use. One do use and one do run. Good advice. Thank you, CDC. How did this get in with the drinking water? Where? I don't remember hearing about this 20 years ago. Is this part of their biology research, biotechnology research? If you need to top off the water in your swimming pool with tap water, do place, that's another do, the hose directly into the skimmer box and ensure the filter is running. Do not top off by placing the hose in the body of the pool or the big dirty amoebas will be. Yeah, that's good advice. Let's see. Histopathology of amoebic meningoencephalitis, PAM. Many of you will play this thing, but we hit it. Dr. Govinda, it's their bomb from the CDC. According to CDC, symptoms start 1 to 7 days, median 5 days, after swimming or other nasal exposure to Naegleria containing water. People die 1 to 12 days, a median of 5.3 days after symptoms begin. PAM is difficult to detect because the disease progresses rapidly, so the diagnosis is usually made after death. Yes, I would say that be a problem. Symptoms of PAM include the following, which should seek immediate attention. The symptoms are experienced. Stage 1, severe, remember you only have 1 to 7 days. Then they're going through your brain. And yeah, we need this. And stage 1, symptoms, severe frontal headache. I get those working. Fever, nausea, vomiting. Stage 2, it's too late. It's way too late. Stiff neck, seizures, altered mental status, hallucinations. And then you relapse into a coma. PAM is often misdiagnosed as meningitis. Uh-oh. Easy to mistake. Meningitis. What is meningitis? Here's the link. HTTP colon slash forward slash www.cdc.gov slash forward slash. Meningitis is a disease caused by the inflammation of the protective membrane covering the brain and spinal cord, known as meninges. The inflammation is usually caused by an infection of the fluid surrounding the brain and the spinal cord. Meningitis may develop in response to a number of causes, usually bacteria or viruses. A meningitis can also be caused by physical injury, cancer, or certain drugs. The severity of illness and the treatment for meningitis differ depending on the cause. Thus, it is important to know the specific cause of meningitis. Yes, I would say so. Okay, folks, this is Secretary Word Duke signing off. Remember, we have free math tutoring on Wednesdays, 5 to 8 p.m., and free math assessments on Tuesdays if your school pigeonholed you in an IEP and forgot to educate you. That happens with you. They stuck her in an IEP, refused to teach her anything past the third grade. I won't name her name, she's very embarrassed. I had a chance to tutor her and we caught her up to speed where she was supposed to be in the sixth grade. We did it in 5 months, but it wasn't easy. And the math assessment took place on Tuesdays, 5 to 8, 5 p.m. to 8 p.m. at Stonecrest Manor, 2801 South Stone Road, 264, in the online study facility. Hey, good evening. And that's UCC Homeschool 272855 2SDP, Superintendent William Reed. You can reach me on the telephone 765-293-4057 or email Mike Anthony home at isp.com. Good you signing off. Have a good evening. Talk to you next week. Bye.
Get up, stand, get up, dance, get up, sing.